Good afternoon. My name is Ivana Petriconi. I'm a staff lawyer at the IAVGO Community Legal Clinic, and I'm speaking to you today from Toronto in Ontario, where our clinic practices. I'm very happy to moderate today's webinar on workplace community transmission of COVID-19. This webinar has been jointly hosted by IAVGO and our partners CAREX Canada, and it's intended for law and labor professionals and others who are interested in workers' health. The goal today is to provide a platform to share knowledge on the evolving COVID-19 pandemic and the impacts that it has had on workers, especially vulnerable workers, in relation to workplace community transmission. In the webinar, we'll cover the results of a recent analysis of media articles on workplace outbreaks of COVID-19 in North America. And we want to share information about workplaces and workers who may be more susceptible to workplace community transmission of COVID-19 in order to highlight missing narratives. We will proceed with two presentations that will follow shortly, and then we hope to leave quite a bit of time this afternoon for your questions, for dialogue, for conversations, so that we can share the information as much as possible throughout the country. In order to ask questions, you can use the chat function that is at the bottom of your screen, or the raise your hand function, which you can locate by clicking on the little participants icon. I think we have a few people joining us by telephone, so when the time comes for questions and discussion, I will give you an opportunity to ask your questions if you're unable to alert us to this remotely. So I'm going to take this opportunity to introduce you to our two presenters today. We have Cheryl Peters, a co-principal investigator of CAREX Canada, research scientist at Alberta Health Services, and adjunct professor at the University of Calgary. And also Mieke Koehoorn, professor at the School of Population and Public Health, associate director, faculty affairs, and co-director of the Partnership for Work, Health and Safety at the University of British Columbia. So I'm going to turn it over to Cheryl and Mieke for their presentations, and I'll be back to moderate the questions. Thank you both.
Great, thank you so much, Ivana, and thanks everyone for being here today for our webinar. I'm going to just... Ivana did go through some of this, and I think most of you know webinar etiquette now, to sort of keep your cameras off during the presentations, and we'll take all the conversation and questions at the end. You will be able to unmute yourself if you prefer to ask a question. And also, I just want to say, we're going to send out a survey afterwards. I'll just send it through the Eventbrite email, just because that's the easiest way. But we're really looking for feedback on both what you think about the webinar today, but also any ideas for new topics that we could hold as our joint partnership between IAVGO and CAREX. So we're very open to COVID and non-COVID related topics that you're interested in hearing about. And I will note that this webinar is being recorded, but you as participants will not be visible, and we will not share the question and answer period when we post the webinar. So Ivana got into this a little bit, but I just wanted to give you a sense of what Mieke and I and our teams have been doing and what our sort of motivations were for doing this work. So we basically wanted to identify occupations at risk of workplace community transmission of COVID-19. We wanted to discuss some of the determinants of that risk for the transmission of COVID-19. We're going to share a bunch of resources on workers and coronavirus and COVID-19, and talk a little bit about some of the evidence gaps and needs on workplace outbreaks or transmission of COVID-19. Just some declarations and acknowledgements. So the research was supported in part with funds from WorkSafe BC, and CAREX Canada is funded by the Canadian Partnership Against Cancer. And I just wanted to acknowledge a few, Don Mooney from Mieke's team, and Emma, Emily, and Shelby from my team, who did a lot of the data analysis work for today. So we had a number of motivations for doing this work together. First of all, this is a really new and emerging exposure for workers during a global pandemic. We sort of had this sense as researchers, and you probably did as well, that there was this increased risk for vulnerable workers, and that we really needed to generate an evidence base to kind of examine if this was really an issue. And we also needed to find some creative data sources for identifying work-related COVID-19 cases and determinants of risk. I'll talk a little bit about why that is in a couple of slides. So what we did, we surveyed North American media reports to identify COVID-19 cases among workers by occupation and industry where we could. And we then compared those media reports, so just news media articles, with reported COVID-19 cases with, firstly, a COVID-19 risk assessment tool that was developed by the Vancouver School of Economics. We have a link to that a little bit later, and I really implore you to take a look at it. It's super useful and really interesting and very well laid out. And the second comparison we did was with workers' compensation claims data in BC. So I'm going to talk more about our comparison to the VSE tool, and Mieke is going to talk more about the workers' compensation claim comparison. We also had a meeting where we invited occupational health experts to review the results and to provide opinions on the determinants of risk for workplace community transmission. And then we also used survey data to investigate sick leave benefits and people in Canada's ability to work from home. So Mieke is going to talk a little bit about that as well. We do have a few polls in here, and I've never done a poll before, so hopefully this works. But the first one is here. So let me just launch this. And I hope that you're all seeing that. So this is about occupation data. So do you think that public health agencies collect data on the occupation of COVID-19 cases? And I'll give it a, oh, I can see it in real time. This is cool. I'll just give it a little bit of time so I can, so there's 46 of us online. I'll just see when we get to a little bit of a bigger number. Okay. This is really interesting. Hopefully when I end this, you'll be able to see it. I don't know how it's going to work, but so it looks like, yeah, share results, perfect. Okay, so hopefully you can all see that. So the majority of you are correct. So there isn't systematic collection of occupation data on cases. There are some, so that's why I kept the unsure option in there. There are some jurisdictions that do collect this information, but only for healthcare workers. So on any other person who's a case, there is no question asked about what their job is. And this is really why we had to come up with some creative solutions for trying to investigate where workplace transmission is even happening, because there isn't sort of a reliable data source for us to use. So I'll just stop sharing that. Okay. Okay, so we're just going to jump into some of the results right away, just to keep this interesting. So what we found is that there is some evidence that the COVID risk tools aligned pretty well with the media reported outbreaks, with some key divergences that I'll talk about in a minute. We also found some evidence that COVID-19 compensation claims also aligned with the media reported outbreaks, but again, with some key gaps. So before I jump into the results, we're going to do another poll. Hopefully this works well. So my question for you is, what kind of job types do you think that we found most frequently in the media reports of COVID-19 outbreaks? So let me just go get poll number 2 up. So looking here for what you think the most common reported outbreaks were in the media. Great. About half of us have responded. Oh, you guys are way faster this time. This is great. Okay, that's good. I think about 3/4 of us have answered. So let's end the polling and I will share the results with you. So I won't tell you what the answer is yet, but it looks like we have kind of a half and half between nurses, aides, and orderlies, as well as industrial butchers. I'll just show you when we get to the results, but some people thinking something else. Maybe we can talk about that in the discussion periods, or other job titles that people sort of thought would come up. So I'll just stop sharing and I will show you what we found. So the industrial butchers were the most frequent outbreaks, unique outbreaks, with 57 unique outbreaks reported from the beginning of the pandemic until late July in North American news media sources. But not too far behind was that nurses' aides. So you guys did great on picking the sort of top two ones that we had. And then you'll see here, these are occupations with 10 or more outbreaks. So kind of the big ones where there were unique outbreaks reported across North America. And so some of these are probably very familiar to you if you've been following the news around workplace outbreaks. Some might be less so, but not a lot of very surprising things here too. I will say, because some of these have these sort of detailed kind of job titles where you need a lot of expertise. So that process control machine operators, those are also people who work in meat plants mostly. So here I'm showing you the media reports of outbreaks among workers by occupation for those jobs where there were just a bit fewer outbreaks. So 2 to 9 were reported in North American workplaces. So especially, I know that the majority of us online today are in Ontario. And so you will be familiar with the farm outbreaks that happened across Southern Ontario, as well as a lot of the bus drivers and subway operators, which again, I think was fairly limited to Ontario, at least in the Canadian context. Certainly there were some outbreaks in the United States as well. You can see here some early childhood educators, some inspectors in public health. These are sort of occupational hygienists and officers that go from sort of plant to plant to investigate outbreaks, and there were 2 outbreaks among those workers, and some security guards and related occupations. So getting down to the less frequent outbreaks. So these are all different job titles where there was one unique outbreak covered in the news media. So you might have seen some of these as well. I find it interesting here because there's a lot of our sort of first responders are in here where we thought that, you know, police officers and firefighters might be at higher risk, but in fact in the media, they weren't really reported to have too many outbreaks, just one apiece here. I'll just leave this up for a moment before I sort of skip along because there are a number of interesting job titles here. One key finding that we were really interested in, given that we were concerned about vulnerable workers, was that a quarter of the media articles mentioned immigrant or temporary foreign workers as part of the reported COVID-19 outbreak. And so these are workers who often work in jobs where they might not have had paid sick leave. They might be less likely to know about their right to refuse unsafe work. And so we were very interested in sort of what are some of these other drivers separate from, you know, what your actual job is and what you do day to day and how much you come in contact with the public, but are there other social determinants of health that are kind of impacting people's risk of getting and perhaps spreading COVID-19? So here I'm showing you the number of unique outbreaks by industry group or sector rather than by job title so that you can have a look at the impact of sector. So you can see here that while that usual suspect of healthcare, where we would expect to have most outbreaks, is really up near the top, there were more unique outbreaks in manufacturing than in healthcare. And as many of you got correct, that's largely driven by poultry and beef plant workers. So they kind of count in a food manufacturing sense. But you can see a lot of people in public administration, which just means government employees. So there's lots of the sort of corrections officers there, transportation and warehousing being bus drivers, taxi drivers, maybe Uber drivers, truck drivers, and then farming and retail trade coming up in the sort of largest industries. But certainly we see that there were not many industries that were spared entirely. So lots of this really crossed a lot of different types of workplaces. Now I'm going to show you how our results compared to the Vancouver School of Economics risk assessment tool. So here are the job titles that the risk tool classifies as at high or very high risk of COVID-19, with the number of unique outbreaks that we found in our media scan. So you can see that the media search definitely aligned with the VSE tool for nurses and nurses' aides, but perhaps less well with some of the first responder populations where we didn't see as many outbreaks as perhaps we thought. And certainly this is an evolving pandemic. We might see this kind of pop up over time as we go forward. I'm not going to sort of go through everything in terms of how the VSE calculates that risk, but it's measured based on the risk factors of each job, and these include things like physical proximity to others, the number of face-to-face contacts, whether the work is done indoors or outdoors, among other factors. And the risk is also measured based on the risk for the average worker in each job, such as whether or not they have to commute on public transit on average, whether they live with healthcare workers, and whether they live in a crowded dwelling. So it is kind of getting at some of those social determinants of health that I spoke about. This is the same comparison here for jobs that the VSE tool classified as in the medium range, so medium low to medium and medium high. So here's where our meat processing workers are coming out. So even though they're kind of classified as of medium risk, we know that they basically dominated the outbreaks that we've seen in occupational settings. And then the other one's kind of in the medium range, a little bit less so. Here I'm showing you now the medium low risk workers as per the VSE, and you can see most of them had pretty sparse media data on outbreaks, with the exception of material handlers. So this is people who were working in like Purelator or Amazon warehouses, and the process control and food and beverage, which again is meat processing plants. And finally, what I find super interesting is here are the jobs where the VSE risk assessment tool classified risk as very low or low. So this is what I think is really interesting, because the VSE tool calculated farm work as very low risk, and yet we had 7 unique outbreaks among this worker population. So some of these, definitely that's driven a lot by immigrant and temporary foreign workers in Southern Ontario. So this is kind of concerning to me that the tool was really saying this is a low risk occupation, and perhaps maybe it is for some workers, but certainly not for these vulnerable workers. So now I'm going to pass it over to Mieke to talk about the rest of our results.
Thanks very much, Cheryl, for that. So one of the other things that we were interested in doing is comparing the occupations that were being reported in the media for outbreaks of COVID-19 with workers' compensation claims data. And the intent of that was, I guess, kind of threefold: to see where there was overlap. In other words, the media reports were kind of a valid source of data, that they were picking up occupations that were recognized as work-related COVID-19 cases and also being picked up by the workers' compensation system. But also we were interested in occupations that were showing up in the media reports that were not showing up in the workers' compensation claims data, and might identify groups that were vulnerable, either because they were afraid to make a claim, they didn't realize it was work-related, and so on and so forth. So this slide here is a comparison with claims submitted to WorkSafe BC, which is the workers' compensation system in British Columbia. Even though the media reports are kind of broadly drawn from North America, it was one source of kind of data that was in the public domain that we could compare to. So what you see here is where the occupations overlap. In other words, somebody in this occupation submitted a claim to WorkSafe BC, and it was also picked up in a media report telling us that occupations were at risk for COVID-19. So I'll let you look at these in terms of where there was. Surprising that I think many of these were high-profile areas in the media, and also were picked up in the compensation claims, in particular for healthcare workers. The very high-profile cases with regards to meat processing, butchers, and also our kind of first responders, so firefighters, police officers, sheriffs, bailiffs, those kinds of our correctional officers were being picked up in the workers' compensation claims. I should say for this comparison that we included claims that were both that were submitted to WorkSafe BC, so we included both allowed and disallowed claims, because we thought it was a signal of the work-relatedness of COVID-19, and where occupations were at risk, where somebody was submitting a claim, even if it was ultimately disallowed at the end of the day. Next slide, Cheryl. So here, it's a lot to look at, but here are where we identified an outbreak of COVID-19 within an occupation in our media reports, but for which there were no claims submitted to WorkSafe BC for this occupation. Now, it's possible that claims have been submitted for this occupation in other jurisdictions, but for where we are right now, we were able to compare with claims out of British Columbia. So it's possible in Ontario, for example, that some of these occupations may have submitted claims. But let you take a look through this listing just for a moment. I think it's listed, I think alphabetically, or it's listed in terms of unique outbreaks and then within that alphabetically. But I think what I want to draw your attention to here in terms of what the media reports are picking up on in terms of workplace transmission that is not showing up yet in workers' compensation claims are occupations in particular. You see here, I don't know if my cursor is showing up on your screen. No, probably not. So if you look through this list, I'll just talk through it. What you see are occupational titles across sectors for laborers. Laborers, for example, in construction. Laborers, for example, in mineral and metal processing. Laborers in the mine sector. Laborers, again, in public works and maintenance, and so on and so forth. There's also consistent job titles for inspectors in motor vehicle assembly, inspectors in electronics assembly, inspectors in health and safety, for example. So you see some occupations consistently showing up here across sectors, but that have not yet been seen in the compensation claims data. Next slide, Cheryl. And finally here for this comparison, what we're seeing are occupations that have submitted claims, at least to the workers' compensation system in British Columbia, but that did not show up specifically in the media reports. And I think the one kind of consistent thing here for the most part is that most of these were very specific occupations within the healthcare sector. So for example, medical laboratory technicians or paramedical or respiratory therapists, nursing supervisors, for example. There's a few others, but many of these were in the healthcare sector. And I think what it's telling us is that when the media reports an outbreak, it may not report specific occupational titles in healthcare. It may report nursing, but it may not make the distinction of a nursing supervisor or a licensed practical nurse, but it would report on an outbreak among nurses. And although there are some other interesting occupational titles here that were showing up in the claims that were not reported in the media outbreaks. Next slide. So we did put all of these findings, the comparison, our results, our media outbreaks by occupation, the comparison to the Vancouver School of Economics risk assessment tool that took into consideration a number of job characteristics that would place occupations at high risk, and the comparison to the workers' compensation claims data. These were individuals with training in hygiene, epidemiology, and public health to take a look at those results for their opinions. And the conclusion is in terms of the occupations that are showing up in media reports and those that were showing up as low risk in the VSC and not showing up in the claims data ultimately pointed to vulnerable workers. And new and emerging exposure for workers who are not in direct contact with patients or the public, but who are in workplace settings where there is workplace community transmission among workers. The occupations that were independently identified in the media that did not show up as high risk in the VSC tool, and were not showing up in claims data, as I said earlier, tended to be occupations like laborers, operators, assemblers, inspectors across sectors. And the expert opinions were that these, more likely than not, are larger working environments, such as factories, plants, warehouses, where there is close proximity to co-workers and an increased risk of workplace community transmission. There may also be some emerging challenges in these workplaces with regards to the ability to implement physical distancing and even to some degree the ability to implement some personal protective equipment. These occupations also in general, when you look at these occupational titles relative to labor force data, Statistics Canada data, and other job characteristics, tend to be lower income. They tend to be occupations with precarious employment relationships, so contract work, part-time work, or workers who work multiple jobs. They also tend to be occupations where there may be fewer employer-paid benefits, including for sick leave. Next slide, Cheryl. I just point you here to what we call the briefing note on all of this work. Here's the link. I think we're making the deck of slides available, but just to show you the link to a summary of all of this work on the media outbreaks and the comparison to risk tool and claims for future reference and more detail. I just also want to share with you two other sets of analyses that we did that were separate from the media reports, but trying to inform the issue of risk among workers for workplace community transmission. We had to take advantage of existing Statistics Canada data to try to understand how many workers in Canada don't have employer-paid benefits, and in particular sick leave benefits. Again, we point you to the link for this research briefing note that you can access later. But there is a poll here. We're curious as to what you think the percentage of workers in Canada who do not have paid sick leave benefits. This is self-reported by employers to a Statistics Canada General Social Survey on working. What percentage of employees report that they do not have sick leave benefits? I got to tell you that I was surprised when I ran the numbers, and so.
This is great.
Yeah.
I'll just give it another second. There seems to be some consensus building.
It does seem to be. I don't see any new entries there, Cheryl, so
okay,
thanks.
Let's end the
yeah. And I'll get you to move to the next slide. And so our group is an educated group. You may have seen some of these numbers reported in the media, but that is indeed the case, that 50 to 60% of workers in the Statistics Canada survey from 4 years ago, but I do not expect that the situation has changed in any meaningful way, reported that they have no access to paid sick leave. I personally did not think it was going to be that high when I ran those survey statistics. I was surprised by that myself. The other thing that I'll share with you here, this survey also asked workers whether their work could be done from home, and what you'll see here is the percentage who report that they could not do their work from home, would be required to go into a working environment to do their work. It varies across provinces, with some of the higher rates up to 40% or just over 40% in Quebec and Newfoundland, and some lower percentages across the country, the lowest 30% in Alberta. You'll also see here, just out of interest, the number of workers who reported that they had absolutely no employer-paid benefits, including no paid sick leave. So no benefits at all from their employer, no health-related benefits, no other leave benefits, but including sick leave. And, so upwards, or sometimes around 10% of workers report that they have absolutely no other benefits at work. Next slide, Cheryl. Also, to try and inform evidence on vulnerable workers during COVID-19 and risks of transmission. Statistics Canada is still conducting waves of the Canadian Perspectives Survey. This is a new survey specific to the COVID-19 pandemic, and they are making the data available to researchers. So we ran analyses for the first 2 weeks when the pandemic really started to affect workers around March 2020, again pointing you to the link to this research brief on these findings for further reference. But just sharing on our next slide some of the key findings with regards to increased impact among workers who have immigrated to Canada, immigrant workers, and the impact of COVID-19 early in the pandemic. And we'll start to look at subsequent waves of this survey as it's released. Immigrant workers compared to Canadian-born workers were more likely to agree that their job is going to be impacted by the pandemic and that their finances would be impacted, both their job and finances are definitely more likely to report that the impacts would be greater for them and their financial security during the pandemic. There were additional findings here, but I just share with you here 2 examples that illustrate that almost on every indicator that immigrant workers were more likely to say they're going to be impacted negatively by the pandemic than Canadian-born workers. Thanks, Cheryl. Slide. Finally here, before we open it up to your questions about what we were looking at and discussion of what we were seeing, we just wanted to point you to some resources that have tried to look at the risk of COVID-19 among occupational groups. And we mentioned earlier the Vancouver School of Economics COVID-19 Risk Assessment Tool. So here's the link to that tool. It's an interactive tool where you can enter in an occupation to search for the risk level of transmission. And you can also look at the indicators that place a group at increased risk. And as Cheryl mentioned earlier, the Vancouver School of Economics really did try to take into consideration some of the social determinants of risk. And I think where we saw the biggest discrepancy is with regards to occupations such as laborers that in their job description do not have contact directly with the public or with patients or with providing care, but are now emerging as at risk due to workplace transmission among co-workers. I point you to the workers' compensation COVID-19 claims data that we use. WorkSafe BC is reporting on all claims submitted to the compensation system. They're reporting on allowed and disallowed claims by occupation, but they're reporting on all claims that are submitted to WorkSafe BC by industry for future reference. It may be helpful to look at what other research is going on in British Columbia. That's my jurisdiction, at least, has an inventory of COVID-19 related research projects that you can search. Next slide, Cheryl. There is data from other jurisdictions that have looked at occupations and outbreaks. In the US, some of our colleagues looking at all occupations by COVID-19 risk. There are other jurisdictions, France and Italy. You may need to use Google Translate if not fluent in French or Italian to identify some of the occupations at increased risk. Next slide. Also, because I believe this group is interested in precarious employment and vulnerabilities, I just wanted to share with you examples of 2 other resources that are focusing specifically on precarious employment and the effects on workers. And some of them have an opportunity now to look specifically at COVID-19. So in Ontario, there is work called PEPSO, which is an ongoing research initiative on poverty and employment precarity focused in Southern Ontario. And here in British Columbia, an initiative with the Centre for Policy Alternatives and multiple universities, BC, Simon Fraser University, on understanding precarious employment in British Columbia, and taking a recent look at workers working multiple jobs during COVID-19. Next slide. So we're going to pause here with thanks to all of the groups that have been involved in this research, supporting the work, helping us get it done, helping us fund some of the activities. Email addresses for both Cheryl and I, should you want to reach out separate from this discussion and question period. But we just wanted to leave time now to open it up for you to ask us questions about what we were seeing, or to raise some discussion points, disagreements, discourse, whatever. We're open to input, because we did have to use novel methods to try and identify occupations at risk and identify some of the determinants, clearly identifying some vulnerable work groups for risk of COVID-19. And I'll stop there. Turn it over to Ivana to moderate our discussion. Thank you.
Thank you very much, Mieke and Cheryl. Those are really very, very interesting findings. Honestly, different from what I had expected to hear. So thank you very much. I will just begin to wrap up by saying that there will be the recording will be posted. And Cheryl, you have the link of, or the list of the registrants for today. So it can be sent out, and we'll also, just a reminder that there will be an evaluation survey sent after the webinar that we encourage you to fill in, not only to know how things have gone for you today, but also if you have ideas of other topics that we can be exploring and making webinars for, please let us know that. And I'll just take a moment to give my thanks on behalf of all of the participants to Cheryl and Mieke for a very interesting presentation, and I look forward to working with you both again on these difficult but very important topics. Thanks, everyone.